You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Paul Mcandrews. We've invited Dr. Mcandrews on the program today to discuss new cutting-edge technology in hair restoration surgery that enables him to create a more natural look than ever before. Dr. Mcandrews, welcome to the program.
Thank you for having me.
Now, before we get into today's topic, your practice.
Well, I'm a board-certified dermatologist that specializes in hair loss and hair transplantations.
Now, by the way, how did you even get involved in in doing that?
I formerly learned the art of hair transplants in my residency at USC LA County Medical Center.
I mean, you always wanted to do that?
It was in my residency that I learned hair transplants, and I fell in love with it.
Is that right?
Yes.
Now, I read some quote. I mean, you're the go-to guy in Beverly Hills when you want a natural look. Is that fair to say? I mean,
I would say it's fair to say.
Okay, good, good. And worldwide, people go to see you.
Yes.
For a natural look. Celebrities,
yes.
Big celebrity following.
Yes.
Okay, good, good. How does that happen, by the way? Word on the street?
Well, I think I'm very fortunate to attract a discerning crowd, and
okay.
I know my patients realize the passion and drive I have for the field of hair transplantations.
Clinical professor at USC. What's your role there?
I'm a clinical professor at USC teaching the residents the state of the art of hair transplantations. And I take this role very seriously because this is where I think doctors should be trained in hair transplantations. I don't believe taking a weekend course or on-the-job training
at one of the bigger clinics.
Absolutely. The vast majority of doctors out there performing hair transplants have no formal training in a residency or a fellowship program.
So you work with Merck Pharmaceuticals, Rogaine. Tell me about that.
Well, I've been a consultant for these two corporations for a while now, and I'm a big believer in the medical treatment of hair loss, and these are the two companies that are striving to make hair loss history. Okay,
now you're chairman of the recertification for the Board of Hair Transplant Surgeons.
Yes, the American Board of Hair Restoration Surgery was started 10 years ago, and the American Board asked me to be chair of the first recertification exam and also write the questions.
Okay, now your own practice, where is that located?
I'm located in Beverly Hills in Pasadena.
Okay, and you trained also at USC?
Absolutely.
Under one of the pioneers?
Well, yes. One of my attendings that taught me hair transplants was Dr. Mike Corbett. He was one of the first pioneers in the field. He started transplants in 1961, and I still see some of his patients to today. He had an impeccable reputation. Patients flew from all over the world to see him and have transplants by him. Well, in the end of my residency, he invited me for lunch, and he said he's been waiting for someone to take over his practice that he trusted with his patients. And I think that was the biggest honor I could have received.
Who is your typical patient that you see?
There is not a typical patient. I see patients from all walks of life, different age groups, and all different parts of the world.
Are they getting younger and younger or older and older?
I think it's staying about the same. And I deal with patients that are in the entertainment industry, in the political arena, in the business world. So I don't think there's any commonality besides the patients that come to me have done a lot of research, and they're very discerning on who they choose to get their medical care from.
You know, when we talked on the telephone, I said I could spot even a good hair transplant 10 yards away. And you said I probably couldn't, see one of yours. But they seem very obvious to me, for the most part.
Well, that's absolutely not true. I think the field of hair transplants has bad PR. The only hair transplants you see nowadays are the bad ones. The good ones you don't see.
That's a good point. The plug look, I mean, you see it though. I mean, you see it as well.
Oh, absolutely. And it's unfortunate because even the bad hair transplants can be corrected. And many of them you could make look completely natural. It actually brings up a patient of mine who had corrective surgery. He came into me, and you could see him from about approximately a mile away. You'd see that pluggy hairline. And I performed the corrective surgery on him. At the end of the day, I came back into the room, and he was tearful. And I said, "What's wrong? Is there something that happened?" And he said, "Well, I can already look at this, and I can tell it's going to look natural. And I have been walking around for the last 15 years looking like this. I can't believe I waited. If you saw this patient on the streets, he looks completely natural. You wouldn't be able to tell he's had a transplant."
Now, the perception, I mean, is definitely, it's become commoditized. There's a lot of advertising all over the place for hair. And the perception is that everybody's doing it the same. We wanted you on the show. I mean, we sought you out.
Right.
We wanted you on the show, and you said, I don't want to look like I'm selling something or pushing it. You just want to inform the public. Because I guess a lot could go wrong in the hands of an inexperienced practitioner. Is that right?
Absolutely.
But what is your difference? Without naming names, we all know the famous advertising with this, because we've seen the graphics of the hair going in. How are you different? You call it the Mcandrews Method.
Well, I think,
what are the differences?
let's take a step back. What makes me different is, one, I've been formally trained. The vast majority of doctors have never been trained in a residency or fellowship.
You're a dermatologist.
I'm a dermatologist.
Add to...
Matter of fact, the first hair transplants was started by a dermatologist in 1959, a dermatologist from New York. And in 1961, Dr. Corbett, my retired colleague, started doing hair transplants in Los Angeles area. I look at the problem with the bigger clinics, they've lost focus. I value the doctor-patient relationship. A strong doctor-patient relationship makes sure the patient and I are on the same page. Well, another thing is, besides being formally trained, I am using the state-of-the-art in the field of hair transplantations, and I'm applying it myself. I'm a big believer, since I was the one formally trained, I should actually be involved in every step of the process.
The consult.
The consultation, the surgery, the post-care.
Is that rare in the business?
Unfortunately,
I've been told
yes.
it's rare.
Yes, unfortunately, I do my consults for one reason. I'm doing the surgery. I spend at least an hour to an hour and a half with a patient, making sure they're realistic about what can be accomplished. And there's no way I can do it if I'm not doing that consultation.
Overall, there's a high level of dissatisfaction, I've been told, in this area. Is it because of that? They don't meet the doctor?
Yes.
Or is it technique driven?
I think it's both. I think it's driven by technique, but it's also patients not getting a bill of goods sold to them that they thought they were going to get.
Okay.
But I think it's getting better. I think this patient satisfaction throughout the world is getting much, much better.
Now, we're going to get to your photos in a moment. And by the way, if you're just tuning in, and I've seen your photos, fantastic. Because I told you, I could spot plugs, hair transplant.
You can't tell a good one.
And these will blow people away. So we're going to show those. But the process, and you call it the Mcandrews Method. And,
yes.
And you think you're an artist. You say you're an artist,
yes.
right?
Yes.
Okay. So tell us the difference. I mean, how do you approach it?
I look at the Mcandrews Method, it was a way to try to standardize the approach of dealing with a person with hair loss. And it's evolved over the last 10 years in the methodologies I use and my philosophy.
Standardize how so?
Well, I think there's three main attributes going into Mcandrews Method.
Okay.
It is basically informed decision, it's artful precision, and it's unparalleled results. What I mean by informed decision, it's so important for a patient to understand the limitations to the different treatment options so that patient can be realistic about his goals and choose the right treatment for him. The number one fear I hear from every patient coming in for initial consultation is, I'm afraid it's not going to look natural.
Okay.
And I tell patients, I have no fear it's not going to look natural. If I do this hair transplant,
is that right?
It will look completely natural.
Very bold.
Well, it's true. Again, if a patient's realistic about what can be accomplished, and I design a conservative hair transplant that not only looks good today, but 20 years from now, I know this patient's going to be happy. Now, I might have to fight with them to make it conservative because you might want to look like a 20-year-old. Well, when you're 40, it might not look natural when you're 40. So you have to make sure they understand the implications
of the
aging process and the further progression of hair loss.
So they may have to come back, though.
Potentially.
And that's not that big of a deal. I mean, if you're in it for the long run and your hair bothers you that much,
exactly,
you go through the process.
Exactly. But then it gets to the point of the limitations to transplants. And I think that's a huge point to bring up.
Okay,
right
we're
now.
going to take a quick break. We come back. Let's talk about that. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about creating a natural looking hairline with hair transplant surgery with Dr. Mcandrews. We'll be right back.